Hey, this video will be of particular interest to general dentists who offer Invisalign, especially those who are not super familiar with tooth mechanics. And that's one of the strengths of doing Invisalign well is to recognize when the ClinCheck comes back which movements are realistic and also which movements are amenable for aligners and which are not realistic. It's all about predictability. I have a great example. This case came across my desk moments ago as I'm working, and I wanted to stop and record this video. This case had previous extractions. We're not closing the space. Even though the patient wants that, I'm going to explain that the teeth are already leaning in. What happened here is that the patient had previous extractions and the orthodontist tried to close the space, but the extractions yielded too much space and the arches started to collapse. That is not the subject of this video, but I want to point out one particular movement on one particular tooth. So look at the lower left 5 and watch as I toggle back and forth. You notice in its position right now, the occlusal table is canted towards the lingual, so the tooth is tilted in. And so the ClinCheck does give a nice net result where you see the occlusal table is more upright, and that's how we would prefer the tooth to look as we expand it out. But when you look carefully and you toggle back and forth, I want you to look at the root angulation as best as you could sort of visualize it. Notice how as the tooth uprights, the root, which is sort of in buccal position, is moving lingually. And if you look at the root from this view, you can see how the root is moving lingually as well. This is called lingual root torque. The reason this is challenging is because you're applying the force at the crown of the tooth, but yet you're asking for the apex of that root and the whole root to move. Force at a distance. It's called placing a moment on the tooth. That is a challenging movement even for braces because the root is anchored in bone and it's also further away from the force. So how can we make this more predictable? Well, it's a very simple adjustment. What I'm going to do is I'm going to take this root torque tool and I'm going to put the root in its original position as best as I see it. Well, I gave it kind of simulating. Now I'm going to tip the crown out. Like so. Now, if you look at the movement, you'll notice how you don't see the root moving lingual at all. You see the crown rolling out. I might even go a little bit more with this, just to prove the point that now I have a uprighting or tipping movement. Think about a mesially tipped molar. If maybe number 30 was removed and 31 is leaning in, you're pushing on the crown to push it back. You're not moving the root forward into the space. It's the same concept. So now the only other adjustment you have to make is this is going to be more profound type of movement. And so I have to look at the upper arch. And the upper arch did have the upper premolar moving out originally, but now since I have more profound crown movement, I have what you can sort of see what would be in prematurity. Look at how the teeth almost look like they're melting into each other. So I have to account for that. And I'm going to also move out the molar here to account for that a little bit more. Now they don't look, maybe I'll go even a little bit more. But my point is this: tip versus torque. You always want to try to look to see where you can tip teeth. It sounds weird because orthodontists sometimes think of tipping as an unstable movement, but not if the teeth were already tipped in a certain direction, like a mesially inclined molar, as I alluded to before. It's tipped mesially, so you can tip the crown back out. You don't have to move the root. You're pivoting like this if this is the apex of the root. Same thing here. These are the little things that will make your ClinChecks be more predictable if you can recognize what movements are realistic and which are more challenging.